Picture this. Could a machine actually outsmart a highly trained doctor when it comes to finding hidden tooth infections in kids? Well, if you've ever wondered exactly how artificial intelligence is reshaping the medical world, you are absolutely in the right place. Welcome to today's Explainer, AI versus dentists, spotting pediatric dental infections. We're diving into a really fascinating recent study that sets up a true medical heavyweight match. We're talking about an advanced deep learning algorithm going head-to-head against final-year dental students to see who can more accurately read pediatric dental x-rays. Section 1, the Pediatric Dental Challenge, Why Kids' X-rays Are So Tough to Read. Before we get to the wild results of this face-off, we've got to understand the core problem. Why is it so incredibly difficult to diagnose dental issues in children in the first place? When you look at a child's panoramic x-ray, it is incredibly visually messy. You literally have adult teeth growing right underneath, pushing directly up into the baby teeth. Trying to spot a tiny infection, what dentists call a periapical lesion, in all that chaos? Well, it's basically like trying to find a needle in a haystack. Now, this highly chaotic phase of childhood actually has a specific clinical name. It's called mixed dentition. It just means a kid has both baby and adult teeth hanging out in their mouth at the exact same time. All that extreme crowding and anatomical overlapping makes it dangerously easy for even the most highly trained eyes to miss a root infection. And if you miss one, it can permanently damage the developing adult teeth hiding right below the surface. Section 2. Enter YOLO v7, AI, the algorithm trained to see the unseen. So if human eyes struggle so much with this visual chaos, how do we solve it? Our high-tech secret weapon here is called YOLO. Yeah, it stands for You Only Look Once. It's an incredibly advanced object detection algorithm. And what makes YOLO so special is its pure efficiency. Older AI models usually had to scan an image piece by piece by piece, but YOLO, it processes the whole entire image in a single lightning-fast pass. That makes it absolutely perfect for real-time medical applications where speed and accuracy are everything. So here is a quick breakdown of how it actually works under the hood. First, the AI mathematically chops the X-ray into a grid. Second, each tiny cell in that grid predicts bounding boxes around anything that looks remotely suspicious. And finally, it simultaneously identifies what that object actually is. It's basically hunting for structural anomalies across the entire image all at once. Section 3. Training the algorithm, teaching a machine to read an X-ray. Because, an AI isn't exactly born knowing what a tooth infection looks like. You have to teach it. To pull this off, the researchers didn't just hand the AI regular, messy X-rays and cross their fingers. No, they used a very specific, highly structured image processing workflow, throwing in some clever visual tricks to help the AI learn much faster. To get the algorithm to focus on exactly the right things, they ran the training images through 3 distinct pre-processing steps. First up, a grayscale transformation. This strips away any distracting elements and forces the machine to focus purely on brightness and density. Second, they applied a Gaussian blur. Think of this as noise reduction. It smooths out any annoying imaging artifacts. And third, canny edge detection. This step specifically highlights the exact boundaries and structural contours of the lesions. They were basically drawing a super clear treasure map for the algorithm to follow. By applying these super smart filters, the researchers were able to take their original, relatively small set of 333 images and artificially expand it into a really rich, robust training set of 408 radiographs. This gave the AI plenty of clear, high-contrast examples to study and learn from before the big test. Section 4. AI versus dental students, the ultimate face-off. This brings us to the absolute most exciting part of the explainer. Here's the exact setup for the big test. In one corner, we have the fully trained YOLO v7 deep learning algorithm. In the other corner, 10 final-year dental students. These are interns literally just months away from becoming full-fledged dentists. Both groups were asked to evaluate the exact same independent test set of 78 highly complex pediatric X-rays to find hidden lesions. The playing field was completely level. And honestly, the results were pretty stunning. The YOLO v7 AI scored a massive 88% overall accuracy rate. The dental students, well, they only managed 76.3%. The machine significantly, and I mean significantly, outperformed the human trainees. But where the AI truly pulled ahead was in its sensitivity. which is just a fancy medical way of saying how well it catches a disease when it's actually there. The AI caught the infections 76.1% of the time. The students, they missed nearly half, scoring just 55.2%. Think about that for a second. In a real-world clinic, those missed infections mean children go untreated. When you look at the overall error rate, the gap is just staggering. The AI made a mistake only 12% of the time, compared to the students' 23.7%. The machine literally made half as many errors as the human interns on these incredibly complex cases. Half! Section 5. The future of dental AI. Support, not replacement. Because right about now, you might be imagining some sci-fi world where robot dentists take over completely. So what does this actually mean for the real world? To put all of this into proper perspective, we really need to look at what the researchers themselves concluded. They explicitly stated that AI systems should currently be considered, quote, supportive decision aid tools rather than standalone diagnostic systems. So, no, AI isn't here to replace your dentist anytime soon. It's more like a highly advanced co-pilot. It's designed to double-check their work, instantly flag suspicious areas, and ultimately just keep kids safer. It's such a fascinating glimpse into a future where bleeding-edge technology and human medical expertise actually work side by side for better outcomes. So I want to leave you with this final thought. Would you feel safer knowing an AI like YOLO V7 was double-checking your kids' dental x-rays before any treatment begins? Let us know what you think in the comments below. Thank you so much for joining us for this explainer. Make sure to hit that subscribe button for more high-tech medical breakdowns and keep learning.